Hey everyone, how's it going? Welcome back to Nightel Narratives. Today's episode is going to be on a very famous and yet misunderstood disorder known as ADHD, which affects millions of people across the globe. In this episode, I'm going to give you some valuable insights into some symptoms of this disorder and things of such sort. But before I jump into that, you have to be aware that none of the words, recommendations, suggestions, and solutions are of my own. They're credited to some famous experts and specialists whose videos and articles I've watched and read. So if you're interested in these kind of stuff and you want to gain some worthwhile knowledge and information as to what this disorder is, what the treatments and symptoms are, stay tuned because we're about to explore the fascinating world of ADHD and uncover some truly eye-opening facts. Okay, here it goes. What is ADHD? ADHD stands for Attention Deficit Hyperactivity Disorder and is a chronic neurodevelopmental disorder that typically begins in childhood and may persist into adulthood. It is characterized by impairments in attention regulation, impulse control, and activity modulation. According to the American Psychiatric Association and DSM-5, there are three presentations. First, inattentive, difficulty sustaining attention, forgetfulness, and disorganization. Second, hyperactive, impulsive, excessive movement, interrupting, impulsive decision-making. And the last one, combined type. Both symptom categories are present. ADHD is not caused by poor discipline or laziness. Rather, it results from neurological differences in brain development and function. Neurobiological basis. Neuroimaging studies reveal that individuals with ADHD exhibit reduced activity in the prefrontal cortex, which is crucial for executive functions such as planning and impulse control. Disruptions in the dopaminergic and noradrenergic systems, particularly affecting motivation, attention, and reward processing. Irregularities in the default mode network, contributing to task disengagement and daydreaming during focus-requiring activities. In short, ADHD reflects functional impairments in neural circuits responsible for attention, inhibition, and self-regulation. Section 3. Symptoms and clinical impact. Core symptoms vary across the lifespan. In children, hyperactivity and impulsivity often dominate. In adolescents and adults, inattention and executive dysfunction are more pronounced. Common features include difficulty initiating and completing tasks, poor time management and time blindness, emotional dysregulation such as frustration intolerance, hyperfocus on rewarding or stimulating tasks, paradoxically linked to dopaminergic sensitivity. ADHD is associated with academic underachievement, occupational challenges, and interpersonal difficulties if left untreated. Section 4. Etiology and risk factors. ADHD is highly heritable, with genetic studies estimating heritability at 70 to 80%. First-degree relatives of individuals with ADHD are significantly more likely to also be diagnosed. Environmental risk factors include premature birth or low birth weight, prenatal exposure to tobacco or alcohol, early lead exposure, psychosocial adversity. Importantly, no single factor causes ADHD. It results from a complex interaction of genetic vulnerability and environmental influence. Section 5. Diagnosis and treatment. Diagnosis is clinical based on DSM-5 criteria. I must show symptom onset before age 12, persistence for at least 6 months, and impairment in multiple settings, such as the school, work, home, and etc. Evidence-based treatments. Number 1. Pharmacotherapy. Stimulants are first line and enhance dopaminergic and noradrenergic function. Non-stimulants are used for individuals with contradictions or comorbid conditions. Psychotherapy. Number 2. Cognitive behavioral therapy, also known as CBT, targets behavioral organization, emotional regulation, and cognitive restructuring. Psychoeducation helps individuals understand their condition and apply adaptive coping strategies. Number 3. Lifestyle modifications. Structured routines, digital timers, mindfulness practices, and regular physical activity have measurable benefit. ADHD is a well-established neurodevelopmental disorder with strong genetic and neurobiological foundations. It's not a matter of willpower, intelligence, or character, but of how the brain regulates attention, inhibition, and executive function. Promoting accurate evidence-based understanding of ADHD is critical, not only for improving clinical outcomes, but for reducing stigma, especially among those who remain undiagnosed or misunderstood. If this video helped clarify the science of ADHD for you, consider subscribing to Night Owl Narratives. We dive deep into topics at the intersection of neuroscience, psychology, and society. Leave a comment if you have questions, personal insights, or topics you'd like us to explore next. Read everyone, and of course, like the video if you found it valuable. Thanks for watching, stay informed, stay curious, and until next time, good night from Night Owl Narratives.